bad, was it?
Well, the bullet entered the right upper quadrant, damaged the liver. We repaired it, drained the area. The gallbladder was badly bruised, but it's viable, so we left it in.
No, I'm okay. I'm okay. That gun I gave you, Trapper, get rid of it.
You want it back?
No. I don't want to see it again. I never want to see any gun again.
Frank, it was an accident.
Oh, yeah, an accident. Who caused it? Me. The big man who knows all about firearms. I'm telling you, get rid of it before you're as sorry as I am.
We'll talk about it later, okay?
I almost killed my own wife.
Oh, she's in stable condition. She's gonna be just fine.
I want to see her.
She's in recovery right now.
I don't care. I want to see her.
Look, she's resting well now. I mean, there's nothing more you can do.
Damn it, I want to be with my wife. I just want to be with her.
Paranoia, that's what it is. I'm telling you, it's everywhere. We've all got it.
You're right. It's the worst kind of social disease.
Jackson? This Brancusi? What's this about a social disease?
Spreading like wildfire, Stan.
We've all got a touch of it.
Well, not all of us.
I'm talking about paranoia, Doctor. Social paranoia.
Ah, yes, that. Well, of course.
The way we're all buying new locks and alarm systems.
I'm even afraid to walk alone at night.
Well, of course, that depends on what neighborhood you live in.
Come on, Stan. We're all a little jumpy nowadays. Why do you think Frank Langtree was so quick on the trigger?
Oh, because his neighborhood's going downhill, too. Now, you see, the way I look at it, security's not a matter of guns, locks, alarms. It's all in the mind. You see, once you've had the proper breeding, live in the right neighborhood.
Hey, your antenna's bent.
That's all right, Jackson, leave it alone. You don't need the accoutrement, proper upbringing. No, Jackson, leave it. Jackson, Jack!
Told you to leave it.
Standard equipment. It came with the car.
Don't hurt yourself.
Oh, Trap, you got a minute?
Yeah, I just have to put something in the car. What's up?
I think we got problems with Chip Begley.
No improvement?
No. Looks like venous congestion. I think he's got some veins that are clotted off.
What are you giving him?
Aspirin and Dextran, but it's not working. Maybe we should consider an exploratory. Use some grafts.
Langtree agree?
I didn't ask him. He's got his hands full at the moment.
Well, you better talk to him.
Okay. What's that?
Frank gave me a present. I didn't want to leave it laying around the office.
A gun?
Yeah, 357 Magnum. This is the ammo. The only thing is you can't keep them together when you're driving around in your car. It's against the law.
You got a permit for that thing?
You're gonna wear the damn thing. I'm just gonna do a little target practice.
What about registration?
Well, they do that when you buy the gun at the store. They send the information in to the police. They run a quick check to see if you're clean. Whole thing takes a couple of weeks.
So you didn't buy it at a store?
That's right.
But being the responsible citizen that I am, I will register the gun for my protection and Frank's in case it's lost or stolen.
When was the last time you fired one of those things?
Not that long.
Well, just don't forget what happened to Frank.
How you feeling? No. No, what I did was so stupid. My God, I almost killed you.
But you didn't. Can't get rid of me that easy. I haven't finished decorating your office yet. Frank, we're gonna have to learn to live with this. You might as well start right now.
I don't even know how to ask you to forgive me.
It was an accident. There's nothing to forgive. Nothing.
How's she doing?
Pretty well.
How are you doing?
Not quite as well.
Well, I hate to bother you with this, but I have to bring you up to date on Chip Bagley. He has definite venous obstruction. If we don't get in there pretty soon, he's gonna lose his hand.
Oh, I can't operate, Gonzo.
Frank, there isn't anybody else.
I'm sorry.
Frank,
Listen, we'll talk about this later.
why can't you operate?
But it just wouldn't be fair to the patient. Look at me. Hands are shaking. I can't even think straight.
Because of me?
No, because of me. I caused this mess. I'm not going to cause another one.
Chip Bagley's your patient.
Well, I just have to find somebody else.
There aren't that many microvascular surgeons in this area.
If I thought I could do the surgery, I would do it. But look at me. I can't do it. I just can't.
Not bad. That grouping there is a good one. You've done this before, right?
Well, not too much. I had a little training in the service. It's kind of like riding a bicycle, I guess. Once you learn how, you never really forget.
When were you in the service?
Korea?
Well, we got a different kind of war now.
Yeah, I know. And I resent the hell out of it. And I spent a lot of years of my life putting people back together again. And here I am now learning how to blast them apart. I mean, it just doesn't make sense.
All on the point of view, Doc. We're teaching armed response here. Self-defense. Try thinking of it that way.
That's not easy. Where I grew up, we were taught to trust people. Now it's beginning to look like every stranger you see is a potential enemy.
It's a matter of survival.
How do you feel about all that?
I'm an off-duty police officer. I moonlight here because too many people are buying these things and using them all wrong. If they feel they need them, they better learn to use them right. Otherwise, they're just as irresponsible as the criminals. Want to try again?
Yeah.
Okay.
Here we go. Gotta call the hospital. Thanks for your help.
Okay, see you next time. You keep shooting the way you are today, you'll be qualified in no time.
Okay.
Mrs. Bagley.
Oh, Dr. Gates, have you talked with Dr. Langtree?
Yes, ma'am.